welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we are going to talk about your health care and some preventative things you can do to stay healthy. My guest is a nurse practitioner with Sentara. Her name is Melissa Glave. Welcome, Melissa.
Thank you. Thank you for having me today.
You know, dealing with their own health care is tricky. I think people sometimes would just like to go to the doctor and say, give me a pill and fix this. And that's not always the right solution, is it?
No, it's not. And it's very challenging because we do want that quick solution. We are very impatient with things, myself included. So it makes it very challenging because we want that quick fix, but sometimes it's not always a fast fix.
It's not always a fast fix. And sometimes, you know, that pill might cause side effects or other things and might not really be the healthiest alternative in the long run.
Mm-hmm, very much so. There's a lot of different types of preventative medicine, and you know, the key is being able to figure out which is individual for that particular person and what works best for their lifestyle. Things do not happen overnight, and so we have to remember that and keep our goals attainable and be able to still function and have live at the highest quality of life.
Well, so as a nurse practitioner, let's talk a little bit about, because, you know, my primary care physician kind of is a nurse practitioner, although I have the doctor too. And a lot of practices now, which I don't think 10, 15 years ago was the case, have a nurse practitioner. What is your role in primary care?
So my role is really very similar to the physician's because our goal is to give basically a person the highest quality of care and help that they can attain. Nurse practitioners usually have a background in nursing just like I do. So our goal is more care focused and being able to, you know, look at that individual person and spend a little bit more time as far as figuring out what they need to make it work. You're right, 15 years ago this was not the case. We have a huge demand for primary care providers. We have a huge demand for health care. We have a huge population and trying to figure out
we're
how
aging.
to...
You know, the whole baby boom bubble is going to be needing more and more.
Absolutely, and we've, you know, got great technological advances, we've got great medicine advances, and the key is being able to care for our patients as they age, and we just don't have enough providers really across the U.S. right now. So nurse practitioners, physician's assistants all step into that role to be able to help meet a greater population demand.
That is, it's really important, and I do think that way the insurance and the time and the number of patients people have to see, you guys do get a little bit more time with people sometimes. So what, you know, and I know it's very, very general, but some common conditions and some common things we can do to live healthier longer.
So basically primary prevention is what you start out with. So the goal with primary prevention is to be able to stop things before they actually occur. Things like diet and exercise are huge. Obesity is related to so many different healthcare issues. Cancers, it's related to heart disease, it's related to stroke. So
Alzheimer's. I mean, there's just it's scary. It is the hardest thing.
It is, and it's, like I say, it's not easy. If it was easy, everybody would do it. So it's very challenging to be able to meet those needs and be able to make those lifestyle changes. It's not, like you said, it's not a quick pill that you can take. It's not anything that you can immediately see a change overnight. And I don't know about you, but whenever I diet, I get on the scale almost every day. That is
absolutely.
Not what
At least every weekday, because it's the exact same time of day, and it's a good comparison.
And then whenever it doesn't change, you lose heart, and then you stop doing what you're doing. You stop making those changes. But we have to look at it more as a long-term solution. We have to look at things in regards to changing up, you know, a few things in our diet, change up things we can live with, and that way we can slowly and gradually get to a healthy level, but it's not going to happen overnight. Exercise is tremendous. It helps prevent, you know, osteopenia, osteoporosis.
It's concern particularly that women need as they, you know, get older. Yeah,
absolutely. We lose estrogen.
And that's more of the strength. The conditioning, the weight kind of a resistance kind of training, right?
But even just walking, you provide impact on your feet, and your long muscles are supporting your body. So really and truly, any exercise is very good and very beneficial, and especially if you're not doing anything before, it makes a huge difference.
I like walking. I think that's just a good way to start. And frankly, it's outdoors. It's a little bit of a stress reducer for me. It's just I work indoors most of the time, and it's a good thing.
Exercise is a great endorphin releaser. People don't realize that it helps lift their mood. But if you notice some athletes, whenever they, are injured or things like that, they actually get down and sad, and because they're not using their body as they were before, and they don't have that endorphin release. So it makes a huge difference.
So what would you tell people who are very sedentary, who are maybe, in their 50s or even 40s and are kind of working an indoor job, feeling very stressed and having a hard time with that weight and exercise component?
So the key is not to give up. Really and truly, do not give up. I always suggest people see a physician before they start any exercise regime, because the key is, if you're able to basically make sure there's no risk factors, you can kind of start off and then gradually increase. Rome was not built in a day, and neither was healthcare, so you have to make sure that they understand that and set realistic goals. Like I say, there's no magic bullet, there's no magic pill, there's nothing that's going to fix it overnight, but don't give up, don't lose heart, and keep pushing, and you will get the goals that you want.
So as far as weight loss is concerned, there are a number of trends and kind of fad diets. Are you seeing that those work? I mean, people, a lot of times, like I've moved through probably 3 or 4 different things.
Oh yeah, I've got a lot of people come in, should they do the fasting, intermittent fasting, should they do the keto diet?
That's big now, which is really kind of another name for the low carb. It's just that one I think has a little more fat requirements, actually. The low carb is you can eat fat, but you don't have to. So yeah, that one. What else? Well,
and there's quite a number.
Oh, the Whole30. There's so many.
The Whole30 is definitely one. The key is, now I will say a few things. The keto is what the biggest trend is currently. The key with the keto diet is it basically you increase your fat intake, so you're burning fat versus sugar and carbohydrates. I think 50 is the max that they do during the keto diet. It actually has been shown that a lot of patients that have seizures have done remarkably well on a keto diet. That's about the only scientific data we can really go with it, because people with heart disease really should not be increasing a lot of their fat intake, because it builds up atherosclerosis on their veins and arteries and increases the risk of heart attack and stroke, which is not a good thing. So certain people definitely should not do it. Each person is an individual. Each person's a little different when it comes to their approach and how they should lose weight, and not everything is going to work. Consistency is the key, because if they're able to change up those, I know, that's the hardest part.
It is.
I had someone tell me one time, they said, I got to where I'm at right now is because I practiced my self-control. I was like, that is a great thing to exercise and a great thing to work on, but we all have to work on it. We're all guilty of it, myself included.
Well, and sometimes following one of those diets is the way of exercising your self-control until you're, able to do it. But I think a lot of them have in common vegetables.
Yes.
We really need to do better about eating vegetables.
Very much so. And, the key is to fast food. We are a very busy nation. We are very quick to go through the drive-thru. I mean, it's quick, it's fast, it's in a hurry. Meal prep I've actually found is really beneficial for a lot of patients, focusing on those lean meats, vegetables, fruits. But the key is to be able to prepare and plan, so that way you're not doing that fast drive-thru because you're in a hurry, or you're not, running through, a restaurant and going out to eat all the time, because if you plan ahead and plan in advance, you can bring that lunch. You can, plan so your dinners are already prepped out, and so you're having a healthy, balanced meal.
That sounds good. Okay, what other, obviously diabetes is very common now, and it is tied to the weight, but not just that. What are some things we can do to kind of stave that off? It really kind of is the same. It's really exercise and weight are, darn it.
I know. Now, genetics is one thing you can't trick. So
That's
genetics
true.
is one thing that it's very challenging to be able to combat that, but there's so many things we can combat. Like I say, obesity is linked to so many different things. So many different cancers are linked to obesity as well, too. Smoking is a challenge as well for a lot of people, and that's linked to a lot of cancers also as well.
Well, and I know vaping is the new thing, but I have recently been reading a lot about diseases linked to vaping.
And it's a little scary. I think of it this way: you're inhaling a chemical. is that ever a great idea? I mean, it's, usually not. It actually has, a lot of them have increased nicotine in it that, compared to cigarettes. They're both not the best option. So the key is to be able to, back off that. And, really and truly, Sentara has a lot of resources that can help people stop smoking. I've even had patients come in that did hypnotherapy and acupuncture that worked tremendously for them. So the key is to not inhale anything would be the option.
Right.
But, that's not always the case.
I have also been reading that liver disease and alcohol issues have been a growing concern, especially among women. And, there's this huge wine joke, wine time, but there's a serious aspect to it too.
It is. And your liver is one thing that if you get so much damage to it, often it does not function the way it should. Your liver is definitely a filter of your body. So if you increase the alcohol content, and women really and truly, I hate to say it, but men get away with a little more alcohol per day than women.
It's not fair.
I know, it just isn't fair. But, really and truly, if they're having more than one glass a day, they need to get regular checkups to make sure that, their liver is not taking an impact or a beating in regards to it. Some wine in moderation is not a bad thing. Red
Right,
wine
there's
has
some heart healthy. Yeah, that's the hard thing. So you hear something like chocolate, dark chocolate's good. Well, then you eat a ton of chocolate, or yeah.
Moderation is the key. It's that self-control practice we have problems with.
It's so hard.
It is. Like I say, I wish it was a magic bullet or a magic pill. It's just not.
So I think there are kinds of different kinds of people, and some go to the doctor with every concern all the time, and others don't go. Oh, that's not so bad, I'm not going to go. But you're saying going on a regular basis, whatever your practitioner determines that regular basis is hugely important.
It really is, because there's so many different things that you pick up with just from a physical exam. I've had, patients that had irregular heartbeat that they didn't even realize, and guess what? If it kept on, it could have, given the person a stroke. So it's being able to pick up on those things early. Early screening is really important. We have problems with, getting patients even to have their mammograms done, or, colorectal cancer is very large in the U.S. It's third in the U.S. right now, and the key is being able to do early screenings to be able to figure out, okay, is there an issue, and let's prevent it or head it off in the past before it becomes an issue, or early treatment so the mortality rate goes down.
Now, that's a screening that isn't fun. Like, the mammogram isn't fun, but it's, 10 minutes, 15, you're out. The colorectal screening, that's kills a day and a half almost with all the prep stuff.
Yeah. And it's hard because the colonoscopy, over 50, really and truly, people should be getting colonoscopies at least every 10 years. The key with that is there's other screenings that you can do, because I've got patients that cannot even tolerate the anesthesia for it, or cannot tolerate the prep work, because you do have to be clean for them to be able to see. So there's things that they can actually do annually that will check for any blood in their stool. And it's a very simple test. You actually bring the little container back to the office and it's checked very quickly. There's one that you can do every 3 years that checks for DNA type cells. They look for trends with that could possibly be linked to colorectal cancer. But the goal is, if you're able to detect it early, they can remove the risk, because colorectal cancer usually starts from a polyp. And once they remove the polyp, guess what? There goes down your risk tremendously. So it gets to where if you can get in early and prevent it early, or, get treatment early, it can save your life.
So what other screenings? Obviously, men need prostate screenings. What other kinds of things should we be aware of, or does it really just depend? Some people need their sugar or the blood levels checked, I guess.
Yep, each person's a little different. That's why we talk about family history, because family history, like I say, you can't trick genetics.
Right.
So the key is being able to figure out what's specific for that person. Age over 50, you have increased risk of cancer problems. So usually we increase the screenings over the age of 50 for a lot of different things. If you have family history of, breast cancer, well,
that is one with serious, DNA connections, right?
Very much so. And there's even gene testing that can be done to determine if you have those markers that could go, okay, this is a definite problem we need to pay close attention to.
so it's just kind of like hard to do all that, to take time off work, to get all that stuff done. How do you support people and encourage them if they're, a little lax?
Well, like I say, Rome wasn't built in a day, so you have to figure out what will work best for that person. We actually have extended hours, a lot of the practices, and weekend hours, which is nice.
I have noticed that, and staying open later in the evenings, to 6 or 7 even sometimes.
Yeah, because it's just a very busy world out there, and the key is trying to be able to meet the people where they're at so we can get them the best health care that we can, but yet still get them in to get the health care, because it is intimidating to go to the doctor. I've got people that have white coat syndrome that come in, their blood pressure is elevated because it's nerve-wracking, and it's completely understandable, but we also want you to have good health, and we want you to live for a very long time, very healthy life, and the key is getting in to get those screenings early. Get your blood pressure checked at the doctor's office. Even if you go to the store and check it and it's high, you go, okay, well, maybe I need to get this checked out, but some people will definitely go, you know what, I'm fine, I feel fine. So they ignore it until they've got kidney problems or other issues that can occur from hypertension. So it's challenging. It is very challenging.
Well, but if we remember, a lot of insurance companies now pay for the preventative care, and they do it because it makes economic sense. Because it is easier, as you said, to remove a polyp during a screening than to treat colon cancer. And so if we all remember that, because it's, there's co-pays, so there's an economic incentive now to go to the doctor and to take preventative care, because we all participate in the cost of our health care, different levels, different ways, and it all depends on things. But it makes sense for our quality of life, for length of life, and economically.
Absolutely. And there's so many different options that are out there in the community too, to where you can get like a free breast examination, you can get a free, mammogram done, you can get, immunizations, you can do things that will actually help your health care, but it does take a little effort, and it does take a little time, and we are short on that, but the key is, we want you to live a long, healthy life. We want you to be able to have the best life that you can, and if we're able to get you in early, get you seen, and get you screened, and get you taken care of, then we can head a lot of things off at the pass.
That's good, and as you say, tailor the plan to the individual, rather than me reading about the latest diet fad and jumping on it. Better to discuss it with my nurse practitioner, which
Absolutely.
I do.
Very good. Good job.
Okay. Well, Melissa, is there anything you want to add about prevention or screening before we close?
No, the main thing, like I say, is we just want people to have the healthiest life we can. Sentara is very much committed to improving health every day, so our goal is to get people in, get them seen, and be able to figure out what works best for them and get them the best care that we can.
Okay. Well, thank you so much.
Thank you for having me.
And thank you for watching. I hope that you will remember to take time to go visit your family care doctor or nurse practitioner or whatever that combination of care is. Do your screenings and pay attention to the really hard stuff, like trying to change your diet a little bit, exercise a little bit, but develop a plan in concert with your provider. Thanks for watching.